Hello, I'm Kaveh Madani, Senior Fellow at the MacMillan Center for International and Area Studies at Yale University, hosting colleagues from around the world uh, on a discussion uh, on modeling and forecast of COVID-19 um, in Iran as part of our contemporary Iran forum, starting with a series of conversations in lockdown through Zoom. Welcome to our show. Please introduce yourself.
Hello, my name is Meead Saberi. I'm a senior lecturer in civil and environmental engineering from University of New South Wales, Sydney, Australia.
Hello, my name is Mostafa Shokoohi, PhD in epidemiology and a postdoctoral researcher or fellow at the University of Toronto, Canada.
Hi everyone, my name is Mahan Ghafari. I'm a researcher in population genetics and epidemiology at the University of Oxford, UK.
Welcome and thanks for joining us from 3 different continents with great time differences. So it's great to have you on the show. You have got into modeling, and these days you're modeling stuff in Iran. Let me start with Meead. Meead, you're an engineer. What are you doing in this field?
Very good question. I'm asking that myself too. What am I doing here? It started a few years ago when I was looking at the spreading phenomena. So spreading phenomena is not limited to a spread of viruses in a population. It could be a spread of a computer virus in internet, a spread of an opinion or fake news in online social media. And more relevant to what I do mainly is a spread of traffic in urban networks. So looking at it from a physics perspective, the spreading phenomena, that's what we've been modeling. And with the recent spread of COVID-19 in Iran, we decided to explore that avenue a little bit.
And Mustafa, what are you doing these days? Who are you working with?
Currently I'm working with researchers at the Kaveh University of Medical Science, as well as our colleague at the Ministry of Health in Iran, specifically working on the predictions, also projections of COVID-19 specifically in Iran, with regard to the total number of infected cases, total number of people who needed hospitalizations, also total number of people die of these COVID-19. That is our main focus in Iran, to predict some key numbers and provide them to our health policymakers to decide better and make decisions based on what they are doing and assess their own specific works and compare them with the models that predict these specific key components.
Mustafa, is this a government project? So are you working with the Iranian government?
Well, actually, I'm not working with the governments, but this is a kind of work that the head of our department and our research center is now working with the Ministry of Health. That is the reason that I'm naming that. Otherwise, we are not working with the government. We are just there's no conflict of interest here. So our models are independent. Our models are totally independent of their view, their standpoint, and their perspectives.
Good to know. And Mahan, you've been a noisemaker recently on social media. What have you been doing, and what is your fascinating finding that you've been so proud of tweeting about?
Well, yeah, thanks for that. Yeah, basically, I think we've been looking at Iran's data for a while. For us, it was a bit of a black box, really, trying to figure out what's going on in terms of the scope and the level of the outbreak in Iran, when it started, how fast it moved. And we had a little bit of success, I can say, now, based on looking at the genetic information we had from the travelers who had a recent travel history to Iran, went back their homes. we managed to collect, get their genetic data from the database bases online and try to work out from that when the outbreak in Iran started and how fast it grew.
So are these infected people who ended up coming to the UK or other countries?
They are from all different parts of the world. So we had the patients going back to Canada, US, many patients to Australia actually, and also a few people in the UK.
And you try to estimate when it all started in Iran, right?
So yeah, that's a very tricky question, right? I mean, we just have like 20 sequences, and from that, being able to go backwards and try to figure out when it all started is a very difficult thing. Obviously, with more data from inside Iran, we would have a much better estimate of what's happening. But yeah, we tried to put everything we had together to come up with a number. And yeah, these genetic information tell us when the likely start of the outbreak was.
I mean, your results made sense, and it was I think, in agreement with some of the statements by the Iranian officials. At least you didn't find it started before China, right? I mean,
no, that's yeah. We're glad that our estimates weren't that far off. Yeah. Sure.
Okay, and this is not a Iranian government-funded project.
No. It's
and Meead, I know you have started the Iran
Yes.
COVID-19 website, and I've even seen that some of the Iranian officials retweet you or like your tweets and tell me if this is an Iranian project.
No, we have that disclaimer on the website as well that it's totally academic independent. Yeah.
So this is something very interesting. So a lot of us around the world work on Iran, even though there is no formal collaboration and no funding coming from the Iranian government or even like other governments. I'm sure these are helpful. But Meead, you are looking into the past a lot, and you're trying to just like Mahan, finding out what has happened. Why does it matter? Like, why do you look into the past?
Right. So what we've been trying to estimate the effective reproduction number, which is one of the major epidemiological measurements to consider when you decide whether to loosen restrictions or impose more restrictions. And we've been trying to establish an association between the interventions that took place and how this reproduction number has been changing over the past. For example, how much closure of schools and universities could have affected the reproduction number, or how much closure of non-essential businesses have changed that number. And again, knowing how that changes the speed of the spread helps with the future scenarios if the spread speeds up again, or making decisions on loosening or imposing more restrictions.
So, and we can now go to Mostafa, but all of you, you're using the data of the Iranian officials, the official data coming from Iran, and the whole world is saying that Iran's data is wrong, or like there is a huge underreporting. We know that all over the world we have underreporting because of testing capacities, lack of protocols, and all these things. But some also accuse Iran of underreporting because of lack of transparency and so on. I don't want you to validate that, but I want you to tell us how would you use the data that a lot of people say are unreliable, and how do you deal with that problem? Mostafa.
Sure. Let's make a distinction here between under-reporting and under-detection. We are dealing with both of them. We know that the number of tests in Iran is not comparable with other countries per population. We know that the number are pretty low in comparison with, for example, Germany or European countries, or any country you may point out that this country probably has higher tests. So when you have a higher number of tests and you can detect the suspected people, susceptible people, or those people who exposed to the infection, so you are able to easily detect them or properly detect them and put them on the number of the cases or add them up with the number of cases. But here, we don't know that whether it's underreporting or underdetection. But I personally believe that these two might come together and these make a problem here. So with regard to this, I believe that it is not the problem of Iran. It is the problem that probably many countries, in particular, developing countries are dealing with. We know that underreporting and also under detection was a key issue in many Western countries, in particular like Italy, Spain, and this sort of country in the first days of the epidemic. So if I want to give you a comment here, I would say that this underreporting plus underdetection was a key problem in many countries, including Iran.
But we know that there's huge underreporting. You, Mahan, I think your study estimated that what was reported was
like it's back in mid March. Yeah. So yeah. Let me say a little bit about that. So back in mid March, we come. I mean, let me back to your main question first. So nevertheless, it's data. It's numbers, and we could learn something from the data, no matter where it comes, how it comes from, how it's collected. It's still data. But yeah, to answer that question, we are now learning much more about this disease in general, given how the outbreaks has played out in other countries in Europe, elsewhere, and we could deal with some of these uncertainties, some of these unknowns, and based off of that, we compared the data from Iran back in mid-March. The age stratified data, which is key to distinguishing between how severe the disease is between different age groups. So from that, we managed to find some interesting results regarding underreporting of number of cases in people of age less than 60 years old. Yeah, I add to what Mostafa and Meead said. It's a problem with many countries are dealing with, but in particular, we could be more specific about where exactly the problem might emerge and how we could deal with that to inform policy as well.
So how do we deal with this problem?
So like I said, so if we know that under 60 years old people are underreported, maybe we should do more targeted testing in those age categories to be able to better estimate the scope and the level of the exposure that these individuals might have had, which is not, on a positive side, it's a good thing that we found out that because of the apparently high death rate in those age groups, we can actually say that actually more people in those age categories have already been exposed to them.
So another possibility can be that in higher age groups, we are under detecting, right? So maybe
so there's this. Yeah, that's a very good point. So we have an issue with comorbidities as well. People dying with COVID-19 or as a result of COVID-19. Those are different things. So especially in elderly, it's a bit of a tricky question because these people might have predispositions. They might already have other diseases that they're suffering from, and COVID it just adds to their problem. But yeah, we could surely say something about those age groups as well. And we had some indications, some preliminary indications that suggest there's likely more deaths in those age groups in Iran than the actual reports that would again suggest there are actually more people dying, sadly, in Iran off of COVID as well.
Clarify this for me. Why do we model, like, given that, yes, you're saying we're learning from it, but you can learn these things, some of these things later on. Do you need to know right now when the start date was? How's that helpful? Can you do that 2 years from now, or shall you do it today? And how's that helpful? And then three of you, 3 different models, 3 different projections. You even update your model every day, every night. You give us a new number, a new peak, a new timing, a new value. So all these projections that you're giving us, now I'm a policymaker or a citizen, the society, how are you guys helpful? Who wants to take that question?
That was a powerful question. I don't know if I could.
Yeah, I was a policymaker at some point.
But no. If I could say just something real quick, and others might add to this. But just a quick follow. If anything, this outbreak taught us, it's that this is a global problem. Iran is not alone. If you think like, oh, I'm in the U.S., who cares what's happening in Iran? They're millions of miles away. It's really not. What happens in Iran would matter for what happens in the Middle East, and as a result, what would then happen in Europe and elsewhere. So it's really a global problem. Learning about individual countries would matter globally. But yeah, I'll leave it to others to
Oh, very political answer.
yeah.
I want to add to this point that models, we know that, all of us know that models are imperfect, meaning that we know that they are not giving us a perfect picture of the status or the situation in each country. However, they are trying to give us, like, that the models are acting or playing like a tool to give us a couple of numbers based on which we can examine what we did or what we wanted to do to deal with the size of the crisis or health crisis we are in it. Meaning that if we estimate a particular number, but our system identified a different number. So here it has to give the health policymakers a point that something is going wrong or something is not perfect. They have to deal with it. How? Probably by scaling up and expanding testing system or testing laboratories, they can deal with this issue, and then they can sort of compensate the problems that they already had it, but now they are trying to identify, detect it, and deal with it. So, go ahead.
So here's the thing. So in doing so, do you really care about the numbers, the actual numbers, or are you thinking about, like, is it more important to talk about trends or rates of changes and if then else, like, scenario testing, scenario analysis? Are you really after predicting the actual number? Does it really matter? This is the question here, because what we hear in the media is that this many numbers, this many people have been affected or infected, or the numbers are much bigger, and people keep talking about numbers. What we don't hear about are trends. Are the things which have been changing, how effective the policies have been, how things can get better or worse. How does it help me as a citizen? If you tell me that, today you tell me that the peak is coming in 2 weeks, and tomorrow or 2 days after, another group from another credible university tells us that no, the peak is two weeks after what the previous group has predicted.
Well, no one can claim that their number is perfect, as I said. But when we know that any number, any estimate comes with uncertainties. The point is that how this number was produced, under which scenarios and under which assumptions. The thing is that we have to be careful how to interpret the numbers and who are our audiences. If our audiences are policymakers, the way we interpret these numbers can be totally different than those who are just general population and they are looking for some specific numbers. So to clearly answer your question, we are looking for numbers, but numbers per se, they are not our main purpose. We are looking for the trend, the patterns, also the impact of our interventions and policies. For example, we want to know that if we increase the level of pressure or the level of lockdown from one step to another step, how many people we can avert, how many people we can prevent to be infected from this infection, how many deaths we can prevent. Based on the size of the differences under different scenarios, health policymaker can make a better decision. Let's reiterate this point that having a number is totally better than knowing nothing or having nothing.
But then if you have too many numbers that are, so if everyone gets into the business of producing numbers, as we saw in the early days, that people did just simple sampling, saying that, oh, out of this, so many passengers who were on this flight, these many people were infected, and then so 20% of Iran's population have been impacted, or this many people have been impacted. Like, out of the members of the parliament, this many people, this percentage tested positive. So extrapolating, to the whole population was the basis of some of the estimates. So these can be also scary, I think, to me, at least, even though I'm not in the field, but understanding a little bit of statistics, I know this is not the way to go. And don't you create panic? Just because you spoke of intervention, I want to ask Meead specifically. Meead, you looked at the past. And if you speak about like intervention, so what is your interesting observation about the past?
Let me start with saying what you focused on in the previous question, and then I'll answer this one. To me, as a researcher, it's an interesting research problem to how to deal with this level of uncertainty. A lot of unknowns in the assumptions, a lot of unknowns in the data. Uncertainty in the model itself. It's not a perfect representation of reality, maybe. So from a research perspective, that's a very interesting research question to work on. From a practical perspective, modeling is a decision support tool. It helps decision makers to make wiser decisions instead of flying blind, I would call it. But going to your more recent question about interventions, what we found was, yes, the interventions that took place in Iran were effective. It reduced the effective reproduction number down. It pushed it down under 1 since maybe 2 weeks ago, 3 weeks ago. But it took a longer time compared to other countries. So for example, in Australia, it only took maybe less than a month for Australia to push down effective reproduction number below 1. But in Iran, it took about 50 days to push it down. Well, that could kind of show how quickly policymakers have been reacting to control the situation in Iran. It probably have been a little bit slower than other countries.
Or even how quickly they are or how effective they are in enforcing their decisions, because there were some decisions in place, but then the public was not following, right? So the decision of closing down the schools, and then people started traveling to other places, like using their holidays. So that is also an interesting observation, I think, which came out of your work.
The effectiveness of interventions are highly dependent on public compliance
as well. So how do you deal with the panic issue? As responsible modelers, how do you speak to the general audience? How do you communicate your findings to the policymakers and to the media? Should you communicate the things you find? Should you tweet about them? Should you hide them and just talk to the people who understand what you're doing?
If you're asking me, I think it's a very difficult question to answer. We have to find the right message to convey. And finding that right message, again, it probably needs a policymaker to actually consult with. Is this the right message to convey?
Yeah.
I would add to that these are like very unusual times, I have to say, for scientists. We're not used to being that fast in terms of predicting everything in real time. These processes take time. Understanding science takes time. Figuring things out takes time. And I totally understand the pressure that the public are going through right now. I'm also, sitting home all day. This can't work forever. But we got to understand that, coming through it and understanding the science behind it is just a time-consuming process. So you gotta give us time to be able to come up with exactly what's going on with this pandemic.
Okay, I'm not to die and give you enough time. And Mostafa.
Well, I believe that modeling as a tool is trying to simplify a very complex and complicated system mainly to the general population, also for health policymakers. But that is not the main purpose of modeling. We know that the process of or the history of this disease, especially this pandemic, is not that easy. We know that getting the infection or being exposed to the infection, being susceptible, or going to the hospital, or getting positive or negative tests, we believe that is not that simple. So we trying to provide simple interpretation, but I personally believe that simple interpretation should come with cautious.
So let's end this interesting discussion by thanking you and using this famous quote that all models are wrong, but some are useful. The practical question is like how wrong they are in order not to be useful. I hope we all be more responsible and communicate uncertainties and our wrong assumptions properly to the general public, and hopefully we have enough responsible media folks and journalists to also find a way to communicate our results properly to the public, to avoid creating unnecessary panic when not needed, and to create panic when it's needed, and the whole society and policymakers must respond. Thank you very much.